Welcome back, everybody, to the Health Optimization Medicine Podcast. We're your hosts, Dr. Jup, Dr. Ted, Dr. Allen, and myself, Dr. Scott. Today, we're going to talk about how what's toxic to the cell is toxic to every organ. And this is such an important piece for all of you listening. There's a foundation that everything lies on. And Dr. Ted saw this in clinical practice very, very amazingly and terribly with one of your patients.
Yes, I had a patient in his late 60s, and he suddenly collapsed, right, and was brought to the emergency room. And I was called, I was here, and I told them that looks like an acute exacerbation of a subclinical mercury poisoning, because I have been monitoring his mercury levels over the past few months. But, you know, being a very, very important person, he had a lot of specialists. So during the time, he manifested several things. He manifested itchiness of the skin, right? Which is, of course, unknown to the dermatologist, actually known to the dermatologist, but didn't bother to measure it. Yes, and so there was that one specialty that was consulted, and then he started having premature ventricular contractions, and so had a cardiologist, and the cardiologist actually at the end point wanted to recommended ablation, right? And then he had two neurologists, right? One for muscle weakness, and the other one is for the electrical, the nerve conductivity testing. So those are by two neurologists. So you could see here already an entire group of specialists. So the dermatologist was just saying pruritus, right? And then the cardiologist said, PVCs, blah blah, and then the neurologist said, well, this is just weakness from old age and so on. And when he went to the emergency room, I actually sent all the testing data. I said, this is, an acute exacerbation of his subclinical mercury. It was ignored, right? All the specialists were called. And then what's nice is that some of the specialists, especially the cardiologist, when I spoke to him, I said, this can be all covered by mercury toxicity. Here's his levels. And he actually said, you know what? I take back my recommendation for an ablation and so on. He said, because all of these signs and symptoms they're having are actually due to mercury toxicity, right? So at least there's one shining light over there. And what I had to do was actually I had to and the toxicologist was called last and told me, I am the last person to be called in these kinds of cases. So it's actually quite interesting, the kind of medical care that we have right now. And I actually, since the hospital had no experience in actually detoxing a patient from mercury, the patient had been taken home, and I had to actually create a protocol for the elimination of as much mercury as I could, right? Which took several sessions. But that shows you how not monitoring for our heavy metals, in our blood, they can accumulate there, right? And so, and illness medicine will look at it from their own specialty lens, and they're not wrong with their diagnosis. It's just they're wrong with the etiology of the disease, right? So, but here you hit one and you hit everything else, right? And that's a sad story of what we have right now in terms of heavy metal toxicity.
And Alan, you see this on a regular basis in the ER, right? When somebody comes in with a syndrome or some symptoms, what do you typically do?
Well, fortunately in the ER, we're not really tasked with figuring out what's actually going on with them. It's just stabilize the airway, the breathing, the circulation, any systems that are immediate threat, and then we hand it off to someone who's much smarter than us. And then unfortunately, those people that we're handing it off to are specialists, and they look at it through their own lens, and they're trying to ask, what can we do, right? So it might be a cardiologist saying, the heart is having irritability. Let's singe or burn off the pathways that are causing it to be more irritable. The kidneys might be failing, so let's put them on dialysis and replace that. Those aren't wrong. But from learning from Dr. Ted and going through the health optimization modules, and the more I change my frame of reference, when I do see a constellation of symptoms, yes, it's important we treat the organ that is being affected, that is at threat, but we can also sit back and go, all right, how did they get here in the first place? So actually a good example that more on an acute time frame, we had this lady who came in and she had itching of the skin. She had strange rashes that were showing up. She had a waxing and waning cognition that was syphilis. I know, yeah. Right? Syphilis, lupus. And everyone was trying to figure out what was going on. Was it a stroke? Was it a bloodstream infection? Everything was coming back normal. And it wasn't until we went back and said, is there anything she's been taking? And we found out that there's some imported vitality tea that she was getting from China over the last 6 weeks. And she'd been drinking this tea, and that correlated perfectly. And we got a sample of it. We sent to toxicology, and we found out it had super high levels of arsenic in it. So again, that is not something that we would typically be on our short list as we're looking at this. Sure. But again, it leads to something is blocking her energy production. Something is going straight into, right? If it's affecting the cells, as we talked about, then if it's not good for the cells, it's not good for the system as a whole. Whether those are brain cells, kidney cells, heart cells, what shows up is going to show up at that time based on what system has the least amount of resilience.
You have a wonderful dog, Wally. Remember that news that the dog chews from China were coated with melamine? What did you do then?
Fortunately, Wally has a pure organic raw diet.
California style.
He's better than us.
I think what's important here to realize is that in the story you just told, the consumption of the toxic was quite acute, but most often these subtle toxicities or deficiencies, they accumulate.
I forgot a background. Sorry, the patient was a pescatarian and ate only fish. Mm-hmm. And so that was a gradual accumulation of mercury. And the last intake was the one that pushed him over into an acute phase. So there's a chronic subclinical toxicity. And then the last bite of that tuna, is the one that actually put him over. Mm-hmm. But the thing is, even if I already advise him to take off the fish from his diet, or have the smash
smash fish, yes.
Yes, as fish, he still refused, right? So with that last bite, that was the one that induced him to collapse, right? A severe muscle weakness and so on. So that's the background of that person.
Well, that feeds exactly into the point I was making, that these toxicities accumulate over maybe a decade already, and you don't have to start optimizing your health or correcting these deficiencies and subtle toxicities when symptoms arise, but you can already do it years before and measure these metabolites that aren't traditionally seen as like a clinical toxicity, but are slowly damaging all your cells with all these downstream effects on all these different organ systems.
I love what you just said, Jup, because we wait for there to be this acute clinical presentation of, their neurologic system is failing, their heart's failing, kidneys failing, and it's obvious. But and in that case that I shared, it was obvious. But for most of us that are just trying to take care of ourselves, to eat healthy, because we're told, hey, fish has high levels of omega-3s, so let's go get as much salmon and sushi as possible, big eye tuna. swordfish, yellowtail, whatever it is. I love sushi, and it's made me rethink some of my own health choices here. But these, you're right, we eat them, and they get these very, very low doses of heavy metals get depoted into our fat, and they get stored. And it isn't, and if you were to take a blood mercury test, it might not even show up as positive. You might find that it's in a very it's not in any concerning level. And so an illness medicine doctor, a toxicology report wouldn't necessarily show acute mercury toxicity. So this is, again, the difference between when we look at a disease state, which is what we look at in illness medicine, versus looking at health. When we back up and say, what could be blocking our energy production? On the metabolomics test, this is routinely done. We look at the urine, and we have very, very low thresholds to detect heavy metals. And anything that might even be a little elevated, you're going to pick up because the body is subtly excreting those.
For the crucial ones like mercury, lead, arsenic, etc., those are intracellularly tested, meaning they actually lyse the cells to actually release them during testing. So we know that, for example, the toxins that you're carrying in your blood are just being transported, but what is really accumulating in your cell is intracellularly tested. So that's a newer technique that just arose a few years ago, where you're actually testing it by destroying the cells, sample cells, and releasing their toxic content.
Yeah, I think to kind of bring it all home here, right? When you're looking at something like mercury, lead, arsenic, aluminum, et cetera, this is all having a detrimental effect on the basic cell, right? The cell's capacity to make energy. These are really cool diagrams. They're all spaghetti looking, as Ted likes to say. But in essence, your citric acid cycle, which is the cycle that helps flip off electrons from our food, every single step along the way is can I sell sex for money, officer? Is it? That's an acronym, or mnemonic for it. But every single step along the way, if you have mercury, if you have arsenic, if you have lead, it's going to stop working. So why do people feel so bad? Is that their mitochondria start getting annihilated in the capacity to make energy. So everything else on top of that starts breaking down: your immune system, your heart, your liver, all those organs that we're talking about, right? But in the end, it's all that basic cell. And so that's what we do when we look at metabolomic testing. We're looking at that basic cell and understanding that it's not basic, it's just the foundation to everything that there is. And so if you look at that level, you're looking at mercury, you're looking at lead, cadmium, arsenic. I had a patient with interstitial cystitis for 10 years, and then they stopped having aluminum deodorant, and it went away, right? And so aluminum toxicity, all these things can do it, right? This is all sort of foundations on the cellular side. And so metabolomics is what we use as a foundational way of looking at the cell in real time. And doesn't take the place of going to the ER if you need to, or going to your family medicine doctor or whatever, but it's the foundation of everything. That's why I'd say it's not mutually exclusive to anything you're doing already. It's just the foundation of everything that we think that you can do now and have real actionable data. Anything else?
Yeah, we'd like to go back to Aubrey de Grey's model: metabolism, damage, pathology. Pathology is already disease. Damage is what they are doing now with all these new things like exosomes and stem cell replacement therapy, etc. And then now that metabolomics is available, we can actually act on the metabolism itself. And that's where health optimization medicine lies, right? It is to optimize that so that you slow down the progression into damage. And that's not possible this is not possible a decade ago, right? So
your quote hits well on that. You always say, just because you're not sick doesn't mean you're healthy. It just means you're not sick.
Yeah.
And our current healthcare system is very good at managing disease, but what we're missing is the specialty that optimizes health. A patient should have a disease management plan for when they get sick, and they should have a health optimization plan for always, actually. And that's what a complete healthcare system should look like, right?
what do you say? Disease is managed, health is optimized. Right?
Well said, as always, Ted. The one-liners, you always got them. Thank you, everybody, for listening to another episode of the Health Optimization Medicine Podcast. We'll see you next time.